and it was just like the worst feeling. So I've tested positive for COVID-19. And I think the most frustrating part is how careful I've really been. And I've contemplated whether or not I wanted to make this video for a few days. But while I feel fine, and I'm so grateful that my symptoms were so mild, that I felt like this video was important to maybe give a fresh perspective on what to look for with COVID-19. I think by now we've all memorized the CDC guideline of symptoms, the fever, the chills, the headache. And I really do feel like most of us are looking for, the worst headache of your lifetime, and burning fever and chills and just like crazy symptoms that are just gonna alarm you that this is COVID-19. And I can honestly say I did not have any of that. Never had a fever, never had chills, never had a headache, was never fatigued. I generally felt fine, which is why I think this video is so important, my symptoms. I woke up one morning with sinus pressure. That's it, just pressure right in the frontal sinus. Hurt to the touch, which is textbook sinus inflammation. I've had sinus infections before. I actually had one about 1.5 years ago that was 10 times worse than any symptom I had during COVID. So I get them from time to time. Didn't seem like the worst thing. And, I wasn't fatigued, wasn't hard to get up in the morning. And I kind of have to say that sinus pressure almost went away when I got up. So it definitely didn't drag my day down at all. But I did have pressure. I did use the neti pot, and fluid flushed right out. So, it seemed like it kind of corrected itself. The next morning, I woke up with sinus pressure again, and if I had a headache during all of this, it was that morning, and the headache was literally right over my sinuses, and it wasn't that bad. And when I got up, the headache went away, and so did most of the sinus pressure, which kind of made it seem like sinuses even more, because while you're laying, that pressure pushes down, and once you stand up, it really got better. And while I felt congested, the congestion was in the sinuses, so I never felt like I needed to blow my nose. Nothing was running, so nothing too alarming. And then in the next day, I think I tried to blow my nose to try to get, relieve that pressure, and there wasn't much mucus, but if there was any mucus, it was clear, which textbook clear mucus is allergies. And that's exactly how it felt. It was like that sinus pressure. By that day, my nasal passage was a little itchy, but no running nose, still no fever. I was checking it consistently because I think we're so key on fever is going to be number one. Yeah, so it just kind of felt like allergies, and having the clear mucus kind of was textbook allergy. And maybe that's where my medical background screwed me, because I just could explain all these little symptoms, and these symptoms were so minor, nothing that even made me second guess. And it has been a little colder in LA, and I have been running the heater at night, and it is common for me to wake up a little congested when I run the heater all night. So again, nothing out of the ordinary. And then the pressure kind of slowly started subsiding, and I think my nasal passages were, remained a little itchy, but nothing that made me think twice during the day. Nothing that made me tired or, no loss of appetite. Nothing was weird. By the next day or two, I noticed that I lost my sense of smell. That's when I got alarmed. And I think we've seen it on the news so much that you lose smell and taste. I never lost my sense of taste. And I think it would have been more noticeable, or at least I would have noticed it maybe a little quicker, had I lost my sense of taste. Because I think it would be noticeable if everything just tasted bland, but nothing tasted bland to me. I had my sense of taste the entire time. So by the time I kind of realized that, like, wait, I can't actually smell this, I could taste it, it was my like first clue. Then thinking back, I was like, wait, maybe that sinus pressure wasn't just sinus pressure. But at the time, nothing that alarmed me. I will say that on about day 2 of all this, I had really bad back pain. But being a chiropractor, the job is really physical. I pull my back from time to time. It wasn't like super alarming back pain. Maybe I just have a high tolerance to pain. But it was like one of the only times that I woke up with back pain, and the only difference with maybe like what I would normally feel pulling my back was that it felt like it pulled into the thighs a little more. But I did do quite a bit more walking in the recent days than I have recently. So it could have been from the walking. I know as a chiropractor, it was like seemed more of like a disc issue than the normal times I pulled my back, just because it kind of pulled a little lower. And I was more worried that, like, I hope I don't pull a disc or, you know, herniate a disc, or because so many chiropractors definitely herniate their discs while working. But I woke up at night, the legs were sore, I had some back pain. I put a pillow under my knees to take pressure off the low back. It's the advice I would give any patient. It helped. So I wasn't that alarmed. And yeah, as I said, I pull my back more often than I'd probably like to admit. So it wasn't that crazy of a symptom. Looking back now that it all kind of went together, you know, it all kind of fits with COVID, but I think we're all just waiting for, you know, just awful symptoms, and that wasn't my case. So definitely try to be more in tune of just all the little things added together. Yeah, I feel fine. I kind of felt fine the entire time. It kind of felt like a sinus infection or like a mild cold that corrected itself over time. Like it just kept getting better, which I'm completely grateful for, and I know not everyone is that lucky. I do have to say that since the beginning of COVID, I can't say that I personally was scared to get it. I know my immune system is generally very good. I eat really well, I'm active, so I wasn't scared for myself, but I was definitely terrified to pass it on. And it was so unknown, you know, a lot of people are asymptomatic, and asymptomatic pass things on, can pre-symptomatic pass things on. So that terrified me, and I think that's probably the same worry of any, you know, essential worker. You never want to be the reason somebody else doesn't feel well. And this entire time, I really only, I think, feared 2 things. One was seeing my parents, because they are older, and 2 was ever having to write an email to my patients telling them I was positive and might have, you know, been around them or exposed them to this. So as soon as I tested positive, I knew I hadn't been around my parents for a couple of weeks now. But the thought of having to email the patients that I recently saw was gut-wrenching, and it was just like the worst feeling. But I mean, I knew it needed to be done. And it took me forever to compile like a few sentences together to email them. And as soon as I sent it, it was just like the worst feeling. And I do have to say the majority emailed me back like within minutes. and were just so sweet and had so much compassion. And I typically don't cry easy, and I don't cry often, but that literally brought me to tears. Like, every single email I received back was just the sweetest. And there was 2 patients in particular that I was really worried about, and they just wrote like the nicest emails back. It was like the best feeling. I just genuinely really care about the health and well-being of my patients, and just having to send that email like killed me. So if you're one of those patients that happen to get that email, if you're watching this and you replied back, thank you. I mean, I don't think I can express how much that actually meant. And if you're not my patient, but ever get an email like that from a healthcare provider or just anyone in the service industry, like, I hope that gives you a glimpse of how hard it is to be on the other side of that. And I hope you have a little bit of compassion, and I hope you email them back. You know, the sooner the better, because that literally just meant so much. I'm making this video not to downplay the symptoms that, you know, they advise us about, but more to be really in tune on how minor these symptoms may be. And if this video gets anybody to, you know, think twice at the first twinge of any kind of sinus pressure or sinus itching, and, you know, get tested quicker and stay away from your loved ones until you know, like, if I can get anybody to just think twice before being with other people, or at like the minor symptoms, you know, making this video was completely worth it. Yeah.